Okay, so we will start our today's lecture on HIV/AIDS. AIDS stands for acute immunodeficiency syndrome, and HIV stands for human immunodeficiency virus. From this infection, the syndrome occurs. So, human immunodeficiency virus. From this, overall, our body occurs some deficiency in our immune system, and we express different kinds of symptoms, and that's what is called AIDS. It is a fatal illness caused by human immunodeficiency virus, and it really compromises our body's immune system, and the person really becomes vulnerable to any disease. That's I was discussing in your class, that many of the diseases had become re-emerged, like tuberculosis, like malaria. Those who are suffering from AIDS, they are also suffering from tuberculosis within quick succession. And when it was first identified, it was really a very life-threatening condition, and all the people, it created a havoc throughout the world. But now, because of the antiretroviral therapy, we have become successful to control this with other public health actions, and this is throughout the world. And luckily for Bangladesh, somehow many researchers, they explain about the social structure, they explain about the religious structure. Maybe these could play a role, a vital role in controlling HIV/AIDS in Bangladesh. Because in 1990s to 2000, up to 2010, kind of 20 years, it started before, say, for example, 84, 85, we started to see the havoc of this disease. But from 90s to at least 2005, 2006, we saw it in a huge magnitude throughout the world. And in India and also in Myanmar, both the vicinity of Bangladesh within the border, both the countries had a concentrated epidemic of HIV/AIDS in India and Bangladesh. But unfortunately, or fortunately, I should say, fortunately, we were able to get away from this deadly disease. And most of the researchers, they explain these two things, probably the political cause or probably the religious cause, or probably both together, played a very vital role to control HIV/AIDS in Bangladesh. Okay. Among the special features of HIV infection, that once infected, it is probable that a person will be infected for life. That means it's very hard to get rid of the virus. If the virus enters our body somehow, and it is very unlikely that it will go away, go outside our body. And this term AIDS or AIDS, it refers only to the last stage of HIV infection at the end. And yeah, we have started calling this AIDS as a modern pandemic, and it's affecting both developed and developing countries. Though now the havoc of the pandemic has become kind of controlled, you can tell. It's HIV/AIDS, if we look at the history, they told that HIV came from a similar virus found in chimpanzees. In United States, these are all the theories, probably entered the United States around 1970. In 1981, CDC noticed the unusual clusters of Kaposi sarcoma in gay men in New York and San Francisco. And at that time, the disease was called GRID, gay-related immune deficiency. And in 1982, the disease was apparent in heterosexuals and was renamed as AIDS, acquired immune deficiency syndrome. In 1984, scientists they identified the HIV. Initially, they called HTLV3 or LAV that caused virus. And in 1985, FDA licensed the first commercial blood test for identification of the virus. And then in 1986, International Committee of the Taxonomy of the Viruses officially named this virus as HIV. 1987, AZT is the first drug approved for treating HIV/AIDS. This is the antiretroviral therapy that I was talking about. And then in 1988, WHO declared the December 1st to be the World AIDS Day. Each year we should celebrate. And in 2008, this person, Luc Antony Montagnier, was awarded Nobel Prize in Physiology and Medicine for his discovery of the human immunodeficiency virus. The current situation, only this figure is the latest one. It's as of February 2022. This is the latest figure. People living with HIV/AIDS and new HIV infections, and other figures are kind of old. You can see that it's 2012. But I looked before presenting it to you, so I could found this latest thing, the people living with HIV. But yes, if I could have more time, I could try. All right. Now, the agent is this. This is the structure of the virus. And we don't need to remember all these things, okay? Because this is a public health or community medicine aspect. Only just to show you the structure of the virus. Okay, so one virus, the variant structure. Only we have to remember this is RNA retrovirus, and because this is RNA retrovirus, that's why the term the antiretroviral therapy. We don't need to remember these freckle shape or whatever. Only this is an RNA virus. That's it. Okay, and I don't think the other things you should need to remember. You don't need to remember. Only RNA virus. That's it. Okay. Can you please mute yourself? Excuse me. It will be better if you mute yourself. Stages of HIV infection. So when a person is infected by HIV, then there is a seroconversion inside his body, and then the person becomes ill. Then he is found HIV positive if we do screen earlier. And because even if there is HIV, he might be asymptomatic. because it starts producing symptoms. Sometimes it has a very, very long incubation period of 10 years even. But yes, there are short incubation period of 1 year too. Within 1 year of infection, patients started showing the symptoms of HIV. So incubation period is very, very big, wide range. HIV life cycle, it infects CD4 positive cells. And
একটি কোশ্চেন ছিল
জি বলো প্লিজ।
এর আগে স্লাইডে সেরো কনভার্সন ইমেজ ছিল, ওটা কি?
আচ্ছা, সেরো কনভার্সন মানে হচ্ছে যে আমার শরীরের যে সেরামের মধ্যে সে পরিবর্তন মানে ইনসাইট করে। কিভাবে করে? এই যে এই CD4 সেলকে আক্রমণ করে। ওকে, CD4 সেলকে যখনই আক্রমণ করে, CD4 সেলের যে ফাংশন সেইটাকে সে অল্টার করে দেয়। অল্টার করে দেওয়ার পরে আমার শরীরে যে সেরামের মধ্যে যে নর্মাল অ্যাক্টিভিটিটা ছিল, সেই নর্মাল অ্যাক্টিভিটিটা চেঞ্জ হয়ে অ্যাকর্ডিং টু ভাইরাস ক্যারেক্টারিস্টিক্স হয়ে যায়। তখন ওই CD4 সেল রেপ্লিকেশন শুরু করে। ওটাই সেরো কনভার্সন। ক্লিয়ার?
জি স্যার, থ্যাংক ইউ।
Thank you. And then it infects CD4 positive cells, that is CD4 cell, and then the T lymphocytes, and then the macrophages, followed by lymph node follicular dendritic cells, and then Langer's cells. We don't need to remember all these things, binding to CD4 by GP120, only if you are interested in immunology or microbiology or virology. If you want to go detail in the virology, then you need to know. Otherwise, no, we don't need to remember all these things. Okay, so we only need to know the public health aspects. These are not okay. And then after that, when the RNA is losing its envelope, then the DNA made from the RNA using the reverse transcriptase. So this is how they invade our body. Okay, then the viral DNA, it then acts as a host with our inside body DNA. Rate of viral replication is regulated by the activity of regulatory proteins. No need. Okay, now in co-infections, of course, the mycobacterial infections, I already told you that HIV/AIDS are also prone to develop tuberculosis. The Mycobacterium tuberculosis, they also affect the HIV patients. So we don't need to go into detail of this. Immune deficiency in HIV infection, so decreased activity of the monocytes and macrophages, activity of the B lymphocytes, cell-mediated immunity response is decreased, and the natural killer cells, decreased activity of NK cells occurs, and altogether it decreases the number of T helper cells. So when you will go and learn about the characteristics of these cells and viruses in pathology in 4th year, then you will be understanding this. And that's why I already told you that this is very much unplanned education that you are receiving, that you are reading these things but not knowing what these things mean. Whatever, just you have to understand that all the immune response inside our body, they get compromised. They are becoming compromised after the infection of HIV. The epidemiology, males are more prone to suffer from the females in all age and ethnic groups, all areas of the countries that are affected. No need. They are calling it the second leading cause of the death for all men aged 25 to 44 years. But now it has come down. No need. Risk factors, anyone of any age, race, sex, or sexual orientation can be infected. But The risk increases if someone has unprotected sex with multiple partners. This is number one. Number two is whether it doesn't really follow if you are heterosexual or homosexual or bisexual. If there is multiple partners, if there are multiple partners and unprotected sex, that is increasing the risk of suffering from this infection. And again, if we know that someone is HIV positive and then we have unprotected sex with that person, again, the risk is higher. And others, it comes sometimes with other sexually transmitted diseases. If someone has other sexually transmitted diseases, he or she also is at risk of suffering from this. Those are syphilis, then herpes, chlamydia, gonorrhea, or bacterial vaginosis. And it also pretty common in intravenous drug users because they share needles. So sharing needle is a very risky behavior, and that's why we found it common in intravenous drug users. And in Bangladesh, only this group of people, they showed pretty high percentage. The prevalence, if I remember, in 2004, it was 4%, and in 2005, it increased to 4.5%, and 2006, it increased to 4.8%. So at that time, we were really concerned about this group of people. But then with the public health intervention, the education and the counseling of those intravenous drug users, gradually the prevalence has come down to probably now within 4% or less than 4%. Okay. Also, newborns and nursing infants whose mothers are tested positive for HIV but did not receive treatment also are at high risk. And during the 90s, we found that there are some areas in Africa, the whole village were infected with HIV/AIDS, and because of the newborn babies, they have got HIV infection from their mothers. So when they will be within their teens, then they will lose their mothers or fathers. By the time the parents will die, and by the time they are at their age of 25 to 30, they will die. So at that time, we found that yes, from the infection of HIV/AIDS, some villages have completely become empty because there were no people living. All of them died. But now situation has changed from that magnitude. Already we talked about these things. Already, these are the indications if someone has HIV and if someone has AIDS, what does it indicate? Okay. I told you that if mother is HIV positive, all the children will have test positive. Okay. About 20% of these will remain positive after 1 year. Breastfeeding and increases the transmission rate. And then as a T, it reduces the risk by half. This is the antiretroviral therapy, the azithromycin. it reduces the risk by half. And azithromycin plus cesarean section, not by NVD, the normal vaginal delivery, it reduces the transmission rate. Nevirapine, I have no idea. I already, I mean, this is my experience. I read about AZT, but I have no idea. It is just, I'm learning from this slide. It is written that if given during labor to mother and to child after birth, it cuts the infection rate to 10%, could be. Okay. Already we have talked about this through sexual contract, through pregnancy, injection drug use, occupational exposure. This is unlucky, and also blood transfusion. This is also risks. Okay. Mode of transmission, always it is when the virus enters the body, either by injecting the infected cells or through semen. So mostly sexual contact, 75% cases is transmission. Most commonly, it's spread. It can spread by having sex with an infected partner, and the virus can enter the body through the lining of the vagina, vulva, penis, rectum, and mouth during the sex. People who already have sexually transmitted disease such as syphilis, genital herpes, chlamydia, gonorrhea, or bacterial vaginitis, they are prone to acquire HIV infection during sex with an infected partner. Parenteral in 15% cases by blood transfusion or blood product transfusion, sharing of unsterilized needles or syringes, accidental needle sticks, and can also spread through organ transplantation. And in Thailand, there had been some incidences. I don't know whether you have heard of it or not. It had happened during those periods of 1995, 96, that people used to hijack with a needle, maybe fake needle, just they had a needle in their hand, because Thailand was suffering pretty much. Huge epidemic crisis in Thailand during the 90s. So people used to have a needle in their hand, and they would catch anybody in the road, and then they would say, okay, give all your money, whatever you have. Otherwise, this is the needle with HIV, and then I will just prick you if you don't give all your money. So this is this incidence has happened in Thailand during the 90s. And after that, the rule had came that donors should be tested, the blood donors should be tested for HIV, and this had minimized the risks from blood transfusion. Also, we talked about it from mother to child, transplacental, or the vertical infection. In nursing mothers, transmission can also occur through the breast milk. Okay. And they are telling that you can't have or get HIV from kissing, hugging, sharing foods, the insect bites, the toilet seats, the bathing, sneezing and cough, and the sweats. So these are the public health awareness that yes, you should not get HIV from these things, activities. Mortality and morbidity in HIV infection. I told you that yes, it's pretty silent disease. Usually it goes unnoticed, and then suddenly the person starts to experience the immune suppression, and then eventually he develops the disease. And the progression from HIV infection to AIDS occurs 8 to 10 years after infection without antiretroviral treatment. Okay. After the introduction of antiretroviral therapy, and then they have developed and improved it to highly active antiretroviral therapy and prophylaxis against opportunistic pathogens. Death rates have declined significantly, and an HIV positive patient older than more than 50 years with a nearly undetectable viral load and CD4 cell count more than 350, they have a less than 5% chance of dying or progressing to full-blown HIV/AIDS within 3 years. This was evident after the introduction of antiretroviral therapy. Okay. Mostly AIDS occurs in adults from 25 to 49 years, 70% of the cases. Adolescents and young adults also 25%. Young children represent fewer than 1% of AIDS cases in the United States. And internationally, children younger than 15 years, they are estimated to around 10% of all HIV cases. Clinical manifestation, AIDS, the last stage of the infection. Center for Disease Control USA, that is the CDC USA, CDC Atlanta, they have classified the clinical course of the HIV infection under various groups. One is acute or symptomatic or latent, and then there is apparent infection, and then followed by persistent generalized lymphadenopathy, then AIDS-related complex, and then after that, full-blown AIDS. This is the last stage. Already we have talked about it. No need. We can just only remember some of the symptoms of the acute stage and some of the symptoms of the clinical latency, and then some of the conditions during the severe symptoms. That's it. So headache, fever, sore throat, muscle soreness, rash, but you will never notice. You will, I mean, the person will seem, oh, it's normal fever, normal sore throat, oh, normal rash. I mean, this goes so unnoticed that anytime a rash can occur in our body, but then we not necessarily will think, oh, this is due to HIV/AIDS. And yeah, in our when we were in our medical science, so all of our students, when we were studying this HIV/AIDS, because we had pathology from third year and fourth year, also community medicine from third year, not third year, it was from first year to fourth year. So I remember when we were reading together, all of our friends, and we were just looking at those symptoms, and we found that most of us has one or any of these complaints. And then we were afraid, oh, did we get this HIV? I mean, at that time, the disease, it created a frightening situation throughout the world. And any sorts of similarities of those symptoms, people used to, you know, they were afraid, oh, did I get this? Because it has become a stigma. Those who are affected, they are being stigmatized inside the community. So that is the reason we need to be aware, and then we were afraid of whatever the symptoms might come, and we experienced, we thought, oh, am I suffering from this infection? Okay, so acute infection, just a flu-like illness with fever, sore throat, headache, tiredness, already we have talked about it, and then it will disappear. That's why you will understand, oh, yeah, I had this and then it disappeared. It's nothing. They call it window period or phase of seroconversion. Some patients do not develop the symptoms after they first get the HIV infection. These are the common symptoms. So I don't need to go into detail, just keep it in mind. And you will not find all of these, maybe only one or two. One person should not get all of these symptoms, maybe only one or only two. So that's why, but lymph glands are swollen commonly. This is common because it affects the lymphatic system. Okay, so this is very important, and patients feels fatigue. That's why we call it immunodeficiency. When our immunity is compromised, we cannot really fight with anything outside. So we very quickly feel tired, very quickly feel exhausted, and then gradually we are getting ill. Okay. And then the second, the asymptomatic or latent infection. So first is the acute infection. We will have some symptoms, but it will be just flu-like symptoms. So people will think that, oh, it's a flu. And all the patients infected with this HIV acute infection, then they will enter this phase of latent or asymptomatic infection. Okay. And then it may last up to several years. And then I told you that from few months to more than 10 years. Okay. So during this time, they very silently, very gradually, very slowly, they kill the immune system, that is the immune cells, the macrophages, the CD4 cells, the T lymphocytes. Gradually they start killing, and then gradually they are becoming stronger and stronger and stronger, and after a long period of time we just start to show the symptoms. Okay. During this time we will have positive antibody test, even though the person has no symptom, but he or she can shed the disease to others. He or she can shed the infection to others. Okay. Then the third phase is persistent generalized lymphadenopathy. So they will find that the lymph nodes are becoming enlarged, and when this time the doctors usually ask the patient to go for HIV test. Okay. And then the patient or person starts to show or develop the AIDS-related complex. The first is weight loss, persistent fever, diarrhea, generalized fatigue, and then signs of other opportunistic infections like tuberculosis, malaria, because these infections, we can get immunity from subclinical infection, but then they remain dormant inside our body whenever they get this opportunity. So they are opportunistic. This is the reason. These are oral candidiasis, herpes zoster, salmonellosis, tuberculosis, and here is Leukoplakia, also malaria. Okay. Other AIDS-related complex, patients severely ill, many of them progress to AIDS in few months. And when we find the CD4 cell count, it falls to 200 or even less than 200. So when it is less than 200, we tell, okay, he already developed AIDS. Okay. Then the full-blown AIDS, the end stage of the disease, representing the irreversible breakdown of immune defense system. And the patient may develop the primary CNS lymphomas and progressive multifocal leukoencephalopathy, dementia, other neurological abnormalities. Kaposi sarcoma also develop pneumocystis, pneumonia, are almost always observed in majority of the patients. This is the picture of a sarcoma. It's indolent multifocal, non-metastasizing, and it's a cutaneous tumor, probably of endothelial origin, but still no one knows the exact mechanism of action, why it is occurring, but during AIDS, we find it. Now come to the diagnosis. So WHO, they have started the case definition for AIDS surveillance. So first we have to go for the sensitive case definition. The weight loss more than or equal to 10% of the body weight, chronic diarrhea for more than 1 month, prolonged fever for more than 1 month, and then the minor signs, persistent cough for more than 1 month, generalized dermatitis, maybe or may not be the history. Necessarily they will not come with this history of herpes zoster, but we find that yes, it's common. Candidiasis and chronic herpes infection, the herpes simplex infection, generalized lymphadenopathy. Okay. And persistent cough, for patients with tuberculosis, persistent cough for more than 1 month should not be considered a minor sign. It will go to the major sign if it is. And herpes zosters, we don't need to. This Bangui definition, we no longer use this, so we don't need to go for this. And then further expanded WHO case definition for AIDS surveillance. Did I discuss about the surveillance? Probably not. Okay, if I get time, I will just discuss one day the surveillance, the outbreak, what does this means and what actually occurs. Okay, now for the purpose of HIV/AIDS, the AIDS surveillance, an adult or adolescent more than 12 years of age, he or she will be considered to have AIDS if a test of HIV antibody. So now you see expanded definition. That means test. When it comes to the test, it is more towards the definitive definition. Okay, so from sensitive to specific case definition with all these sensitive symptoms or signs. If a person is testing positive for HIV, and then one or more of those things given below, different symptoms and signs, then we will be considering as definitive is a candidate of HIV/AIDS. Laboratory diagnosis, detection of antigen, and usually we don't ask for it following a contact. As the blood transfusion, the viral antigen may be detectable in blood. So that means after blood transfusion, if we check whether the person is having this problem or not, we can find it about 2 weeks. Okay. These are we don't need to go for any of these. No. Only you have to know the name, that we have to detect the antigen, and we detect the antigen by ELISA method. Okay, that's it. And maybe sometimes in your Viva examination in professional, the teachers might ask you, what does ELISA mean? If you can tell, that's it. They will not go into detail, nothing. Only just the teachers, the professors want to know what does it mean. Anyone can tell?
No. So enzyme-linked immunosorbent assay.
Very good. Enzyme-linked immunosorbent assay. That's only, you can tell the name, that's it. Nothing more from these 2 slides. detection of antigen through ELISA or ELISA method, ELISA assay. Okay. No need to remember these generations. No. No. Only, yeah, only you can just know this, that this HIV, this ELISA, this is being used for screening. So screening test, okay? And you can see this terminology, sensitivity, 99%, 99%, 99.9%. So that means these are the things only the teachers might ask you, okay? Western blot, no needs, CBC, absolutes, no. Okay. Supplementary test, only you can know the names, but don't worry. Just you only need to know the name. Only you can be asked. But most importantly, if it is asked in your exam, you will say that detection of antigen by ELISA method. That's it. No one will ask you these things. And even if someone asks you, it means the professor will give you honors mark or the professor will give you fail mark. So don't worry about these slides. Prevention, the risk of contracting HIV increases with the number of sexual partners. No, these are not. I'm sorry. I should have prepared the slides for you. But now I have become so busy, it's not possible for me to spend time to prepare the slides. Okay. The blood, of course, it should be screened every time. Now the blood should be screened for so many things. Now probably the 5 diseases. If I forgot those. One is HIV/AIDS. Another is tuberculosis, herpes. I don't remember. We have to check. In Bangladesh, government, the Ministry of Health has taken this initiative that every blood transfusion, every donated blood, every bag should be checked for at least these 5 or 6 diseases. It was 5 diseases initially, but now I don't know whether it has increased or not. Treatment is antiretroviral therapy. That is the key to successful control the infection rate. So, plus there are some other drugs with different mechanism of actions, but antiretroviral therapy, this is the key. Okay. All right. Yes, any question? Any question? Okay, if there is no question, we want to